Hey everyone, my name is Megha Parthasarathi and I'm a graduate student at Eastern Illinois University. And I'll be talking to you about my systematic review on vegetarian diets and mental disorders in adults. So before we get started, I wanted to talk a little bit about an overview of what I'll be presenting today. Uh, First of all, I wanted to start with the background, which is basically some terms that need some further clarification and some statistics on the occurrences. The purpose of my study, my methodology, results, discussion, which includes my strengths and weaknesses that I have included, and finally the conclusion and further implications that we can use as future RDs. I wanted to briefly talk about the background and some of the terms that I will be discussing. While vegetarian diets can include various components and there are different perspectives on vegetarian diet, the studies that I've included, they mostly focus on lacto-ovo-vegetarian diets, which is you exclude meat, fish, and poultry. Lacto is like milk, ovo means egg, so both eggs and milk are included in the lacto-ovo-vegetarian diet. As far as nutrients, it tends to lack protein, iron, calcium, zinc, B12, riboflavin, omega-3s, and vitamin D. And when it comes to mental disorders, for the most part, I'll be focusing on anxiety and depression. That was kind of the focus of most of the articles that I've chosen. So a common mental disorder would be like the anxiety and depression, which is defined as the anticipation of future threats, an excess of fear, and related behavioral disturbances. So the purpose of my research and this presentation is to assess the influence between adults who eat vegetarian diets and those who experience mental disorders. So my methods included using 3 different databases and with inclusion-exclusion criteria as within 2009 to 2020, so roughly about 10 years. The participants must already be following a vegetarian diet and not be experiencing it for the first time during the study. They must be adult participants, and they must not be pregnant, lactating, or having any pre-existent mental disorder before the study has been conducted, and also to make sure that it is peer-reviewed. After searching through the databases and searching key terms of vegetarian diets and mental disorders and keeping in mind of the exclusion and inclusion criteria, I managed to narrow down 10 primary resources. Some of the common findings were that there was some correlation between vegetarian diets and mental disorders. Overall, about 6 of the studies suggested that there was a correlation between consuming vegetarian diets and increasing their risk of mental disorders. But there is no evidence that showed the diet is the etiology or the cause of one's risk of developing the mental disorder. After analyzing the results, I had to keep in mind that the concept of correlation does not equal causation. So the results suggested that while there is a correlation between vegetarian diets and mental disorder, it is not the causation of mental disorders, and that there are many other factors that play into one's risk of getting a mental disorder. Based off of my conclusions, there was a correlation between vegetarian diets and mental disorders. So to address the vegetarian diet for health professionals, I would suggest that they should encourage supplements or inform the clients of food rich in the nutrients a vegetarian diet would lack. And I would also suggest, for further research, to be more specific on vegetarian requirements. As you can see, many people's opinion on vegetarian diets are different, and which includes what foods are included and what are not. It should be more clarified. And there should be more studies on direct effects of mental disorders as well. So here is a list of my references, and I really hope you learned a little bit about vegetarian diets and its influence on mental disorders. And again, I'd like to thank you so much for listening to my abstract here. Thank you. Bye.